Welcome to the Health Bulletin. There's new evidence that bird flu is more widespread among America's dairy cows. The FDA says the virus has been detected in about 1 in 5 tested samples of milk taken from stores. Health officials say this is likely not a threat to humans because of pasteurization. The dairy industry has been ordered to now test cows being transported across state lines for possible infection. Listen what WHO has to say from the expert.
Available treatment or control measures. WHO recommends countries strengthen surveillance in settings where humans and farmed or wild animals interact. WHO is also continuing to engage with manufacturers to make sure that, if needed, supplies of vaccines and antivirals would be available for global use.
Before we move forward, please hit that subscribe button and join our Health Bulletin community.
Vaccines ready at all times. So there is a candidate vaccine. It is ready if it should be needed. And the whole purpose is to get that advance warning, to know what's coming if we can, and be ready to react really, really quickly if the virus either shows signs of becoming more transmissible in the human context, because all of the cases, most cases of H5N1 really are a result of unprotected exposure to sick or dead poultry or products. So, and we've seen an increasing range of potential exposure scenarios. Anytime there's a variation in suspected exposure, anytime there's a sign that the virus is more transmissible between humans, or anytime, and what is worrying about H5N1 is that it's quite a virulent virus in itself. The case fatality rates for H5N1 in an infected human are very, very high, way higher than in COVID. That's in some ways expected because this is an avian virus. It's not used to the human environment, and it tends to be very dangerous in a human when it infects humans. But humans are not easily infected by these viruses because they're not human viruses, they're avian viruses. But I have to again pay tribute to that band of labs and people and individuals and institutions who maintain this protective sort of mechanism, this network, this net of protection around the world that makes sure that we have early warning. It's a little bit like what people talk about meteors that are coming to the Earth. We have a system that can detect them, we have a system that can measure, and we have countermeasures ready to go should anything happen. And that's all we can do in public health. That's all we can do in life. We can't stop living because viruses threaten us. They've threatened us forever. What we can do is know about it, and what we can do is be ready to respond. And again, a tribute to the colleagues who work in the influenza. And much of this is supported through the pandemic influenza preparedness framework, which has been in place again for 20 years and has provided a framework for collaboration between WHO, labs and industry for the sharing of material, for the sharing of vaccines. And it's timely as next week. What we've learned in Ebola outbreaks is you need to react quickly. You need to go after the virus. You need to stop the chains of transmission. You need to engage with communities very deeply. Community acceptance is hugely important. You need to be coordinated. You need to be coherent. You need to look at the other sectoral impacts, the schools and security and economic. So it's essentially many of those same lessons. But the lessons I've learned after so many Ebola outbreaks in my career are be fast, have no regrets. You must be the first mover. The virus will always get you if you don't move quickly. And you need to be prepared. And I say this, one of the great things in emergency response, and anyone who's involved in emergency response will know this, if you need to be right before you move, you will never win. Perfection is the enemy of the good when it comes to emergency management. Speed trumps perfection. And the problem in society we have at the moment is everyone is afraid of making a mistake. Everyone is afraid of the consequence of error. But the greatest error is not to move. The greatest error is to be paralyzed by the fear of failure. And I think that's the single biggest lesson I've learned in Ebola responses in the past.